Hi, this is Lois Haggard. I manage the Community Health Assessment Program in the New Mexico Department of Health. This is part 4 of the Community Health Assessment video series. In the previous video segment, we talked about where we get objective data for community health assessment. This short video will look at a particular way of using data, calculating rates to assess health risk. Our definition of data mentions measurements and statistics. We use a statistic called a rate to portray population risk. Technically, a rate is a type of ratio in which the numerator is also included in the denominator. But instead of getting all technical, let's just look at some simple data. Sometimes we use counts of health events. Counts are statistics, and they can be useful. This example looks at the number of births in the population and the number of OB/GYNs that would be needed to serve the needs of the community. If one obstetrician can serve 100 pregnant women in a given year, and the community had 900 births on average in each of the last 5 years, then 9 obstetricians will be needed to serve the expected number of pregnant women in the community. But counts have limitations in assessing risk. This table shows the number of births to teen moms in 4 New Mexico counties in 2015. Bernalillo County had the highest count, but that county also has the highest number of teen girls in the population. So it's hard to tell if teen girls in Bernalillo County have a higher risk of giving birth compared to the other 3 counties in the table. There are more teen births, but also more teen girls, so we would expect there to be more teen births. How can we better use these data to evaluate risk? To evaluate the risk of teen birth, we need to look at the rate of teen births in each of the counties. In this case, the rate reflects the number of teen births per 1,000 teenage girls in the county. A rate is just the number or count divided by the number of persons in the population. That gives us a very small number with lots of digits to the right of the decimal point. So to make this number more readable, we multiply by some factor of 10, like 100, 1,000, or 100,000. That just moves the decimal point over so we have a more legible number. For teen births, using a multiplier of 1,000 gives us numbers that are easy to read. In this example, after we calculate rates for each of the 4 counties, we can see that Torrance County, the county that had the smallest number of teen births, had the highest teen birth rate. Among the 4 counties, Torrance County girls were the most likely to give birth, or we could also say we're at the highest risk for teen births. Here's a graph of those teen birth rates for the 4 counties. The different height of the bars indicates the different risk levels. Bar graphs are one way to visualize the data. The risk for teen births is higher in rural areas than in urban areas, not just in New Mexico, but in other states too. If we trace teen births, our outcome measure, back to its contributing factors, one of the things that contributes to higher teen birth rates in rural areas is that adolescents who live there have less access to contraceptive services. The public health model would suggest that improving access to contraceptive services in rural areas would be one way to reduce our teen birth rates in New Mexico. In summary, we use data such as counts and rates of death, birth, injury, and disease to indicate a community risk for various health outcomes. Rates are the number of health outcomes per person in the population multiplied by some factor of 10. Rates are typically more useful than counts for assessing the level of population risk because they take into account the size of the population. This is the end of part 4. The next video in the series is about a special kind of rate, an age-adjusted rate.